Hi, my name is Rebecca. I'm going to be performing how to put in a Foley catheter today. So when I walk into the room, I'm going to perform hand hygiene, and I'm going to ask 2 identifiers to the patient. So I'm going to ask the name and date of birth. So, hello, Matt, what is your name and date of birth, please? And she's going to respond with that information. I'm going to check that against her wristband. So looks like everything checks out. So now I can go ahead, I can explain the procedure to the patient. So we're going to be putting in a urinary catheter to help relieve some of her, maybe some of her retention, anything for whatever reason that the healthcare provider had reason to put in a catheter. So I can go ahead, we're going to first raise her up because we're going to perform pericare first. And if she has any questions, I can explain those to her or give her help reassure her or anything that she wants me to do. And so before we start anything, I'm going to assess for pain. So, ma'am, what's your pain scale today? Feeling okay? And she can tell me her pain scale. She says it's a 4. So now I can go ahead and I'm going to assess her abdomen, make sure that there's no distension, no wounds or anything that would possibly mess up what we're going to do. So I'm going to go ahead. Everything looks fine. There's a little bit of a bump, but that's going to be normal because she's having some urinary retention. So I can go ahead, I can cover her back up, and before we actually start, I'm going to provide privacy because we want her to be in a nice environment. That way she's not uncomfortable or feels awkward or anything. All right, so now I can go ahead. I'm going to perform hand hygiene again for 15 seconds. All right, so now I can go ahead, I can start the procedure. I'm going to put on clean gloves that I've had prepared. And the materials that we're going to need for this procedure today, we're going to have washcloths, a towel, and a bed towel. And we're also going to have a basin full of nice warm water for her to actually give the bath to. All right, so we can go ahead, we're going to cover her up. That way she doesn't get cold or uncomfortable and helps her feel a little less exposed. All right, so to make sure that she's comfortable the way she wants to be. All right, you can see that good there. All right, so now I can go ahead. First, I'm going to start washing her. And so we're going to have our water. Make sure that she's nice and washed. So we're going to go outer labia first. And we're going to wash it if we need to. It depends on the situation. If she's really soiled, we might have to change washcloths, blah, 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 blah. All right, so inner labia, go inner. Get that. Then you're going to labia majora on the outside. Then on the inside towards me. Wash that. We're going to go straight down the middle. And we're going to also, if she has any other possible, like anything that we need to clean up, otherwise we can do that while we're here. All right, so now we can go ahead, we can pat her dry, and I would have had a towel laid down prior, that way we don't have to change our bed sheets again while we're doing this. So now we can go ahead, we can pat her dry. And that's going to help prevent any infection that could possibly happen, because it's a pretty common thing with getting in a catheter. So now we can go ahead, we're done with the pericare, so we can throw away our laundry. In the laundry hamper, we can get rid of our bath basin, and we can also dispose of our gloves while we're at it into the trash can. All right. So I'm going to go ahead right away after I take off my gloves, I'm going to perform hand hygiene once again. All right. All right, so now I can get out my catheter kit. We're actually going to put in the catheter now. And so this is my catheter kit. It comes with all the supplies I'm going to be needing for today. And so we're going to take this out. We're going to roll it up, use this as a trash bag. You don't have to, but it's just easier and it makes sense for me. All right, so throw away our top. All right. Get my towel back. All right, and this is sterile, so we're going to open it like a sterile packaging, so we're not going to touch the inside. Keep everything clean. All right. And so we're going to go ahead, we can remove our gloves without touching anything in the packaging. All right, when we're done with that, we can go ahead and dispose of our wrapper by touching the inside. We're not going to contaminate our sterile field. You can throw that away. And so now we can go ahead, we can get our supplies ready. We can first take our little pad here. We're going to put this underneath the patient. So we're going to have the shiny side down onto the bed. Good. And that is going to be our sterile field down by the patient. So now we can go ahead, we can get our supplies ready. This is all sterile and I've maintained sterility. So I can go ahead, I can rearrange this to make it more comfortable to work for me, as long as I stay within that outer 1-inch border. So I can go ahead. I have my little cotton swabs. I can rip those open. And I can dump them out on my tray and throw these away. So. All right, so now we can go ahead and we can prep our catheter, which is already prepped for me. All right, so I can go ahead, we can take our saline, we can hook it up to the catheter. We can remove the plastic as long as we're still sterile. And this can also be thrown away. All right, now we're going to take our lubricant. We're going to open this. I'm not actually going to for video purposes, but in actual reality I would. And I would lubricate the end of this catheter. So now I can go ahead, I can put it in my little tray here. And I have my name tags ready for later use. All right. So now it looks like we're all ready to go and the patient is all prepped. So we can go ahead and we can move this onto our sterile field down with the patient. So we can go ahead. And now since I've turned my back to this, I can't really use it ever again. So now I'm going to clean the patient with my swabbing, which looks like you can see it pretty good. All right, so I'm going to make my non-dominant hand, which is my left hand. I'm right-handed. So I'm going to spread apart her labia, and now I'm going to clean her with the antiseptic. So I can go, you're going to go outer, then throw it away. Then I'm going to go labia majora towards me, and I'm going to maintain sterility and throw it away. Same thing with labia minora. Outer edge, throw it away. Same thing but towards me. Outer edge, throw it away. And then once down the middle. There we go. Throw it away. And so now we can take the catheter out of the lubricant. We now have that sterile. I can get rid of my top part because I'm no longer going to need this. And once I do, it's no longer sterile, so I can't do anything with it. So now I can go ahead, I can put the catheter in the patient. I'm going to insert it about 2 to 3 inches until I see a urine return. Then I'm going to insert it again another inch. So I can go ahead. All right, I am seeing a urine return, so I'm going to advance another inch. Now I can hold the end of the catheter with my non-sterile hand. and I can blow this up with the balloon up with my sterile hand. And if she was complaining of any pain, I would immediately stop, and I would advance the catheter, another inch. So I pop that off. This is now can go into the trash can. So I can go ahead, maintaining sterility. I can throw that away. And now the actual sterile procedure is done, so I no longer have to maintain sterility. She is comfortable, and I do not have a leg strap provided for me, so I'm going to verbalize it. So if I had a leg strap, I would strap this to her leg. I would label it with my labels, and I can go ahead, I can hook this to the side of the bed frame down here, and I'm going to observe the urine for any color. I'm gonna look for any kind of abnormalities that could be according with it. So now that we're all done, she's all strapped up, all ready to go back and doing whatever she was doing before I entered the room. So now I can go ahead, I can get rid of all of my garbage. So I can go ahead, throw everything in the trash can. I'm not actually going to because we reuse this a lot, but I would throw it away into the trash can. I would immediately discard my gloves. And right after doing that, I would perform hand hygiene once again. And if she was feeling any uncomfortable, if she was feeling any pain, she could report that to me, and I could possibly help remedy that, or I'd have to document it, obviously, and anything else that could possibly go along with it, I could do that. So now I can go ahead. I've discarded all of my trash, pretend that's in the trash can, and I can make her comfortable again. And I would label my tubing with my signature, my date, or the date of it. So all of this is thrown away. My towel is in the laundry hamper now. And so now I can go ahead, make her comfortable again. Back to where we found her. So I can put her legs down. Roll up. Pull her gown back down while I'm at it. All right, and this would go in the laundry hamper as well. And so before I leave the room, I'm going to provide any safety. So I'm going to lower her back down to the ground again. I'm going to bump the bed, make sure that it's locked. I'm going to make sure that her call light is in reach and that she knows how to use it and to actually use it if there's anything that could go wrong. I'm going to open up her curtain again. I can bring back her personal items. And before I leave the room, I'm going to ask her if she needs anything. So, ma'am, do you need anything? And she says no. So I can go ahead and I'm going to document this. I'm going to document the time, what I did, anything that could have went wrong, like any kind of complications at all. And so now I can go ahead, before I leave the room, I'm going to once again do a check the room, assess everything, and then before leaving, I'm going to perform hand hygiene.